Hello, I'm Dr. Sarah Williams, speaking to you from here in the UK. If you're over 60 and taking tablets for high blood pressure, many of my patients are surprised to learn that some blood pressure medications, while life-saving, can quietly increase the risk of. This isn't about taking medication incorrectly, it's about how the aging body responds differently, even to treatments you may have used safely for years. Today, I'll walk you through the blood pressure medicines doctors monitor mostly in older adults, so you can adults.
If you are over the age of 60 and currently taking medication for high blood pressure, this video may be one of the most important you watch this year. While blood pressure medications save lives every day, cardiologists are now raising concerns that some commonly prescribed drugs may carry hidden risks for older adults, risks that do not always appear immediately. These concerns include side effects such as sudden dizziness, drops in blood pressure when standing, increased risk of falls, confusion, and complications that can slowly reduce independence over time. Importantly, these issues are not caused by mistakes or misuse. They occur because the aging body processes medications differently. Research from institutions such as Harvard Medical School, the Mayo Clinic, and other leading medical centers shows that certain blood pressure medications require extra caution after the age of 60, particularly when doses, combinations, or long-term use are not reviewed regularly. Today, we will discuss 6 blood pressure medications that doctors monitor closely in older adults. This is not meant to alarm you, but to help you have informed and productive conversations with your doctor. Before we begin, please comment below with your age and where you are watching from. We always enjoy seeing where our experienced viewers are joining us from. Now, let's begin. Number 6 on our list includes alpha blockers and combined alpha-beta blockers. These medications are sometimes prescribed to help control high blood pressure in older adults. They work by relaxing blood vessels, allowing blood to flow more easily and lowering pressure. At first glance, this seems beneficial. However, this same effect can create problems as we age. Cardiologists and geriatric specialists have long linked these medications to orthostatic hypotension, a sudden drop in blood pressure when standing up. As we get older, the body becomes slower at regulating blood pressure. Blood vessels do not tighten as quickly, and heart rate responses are less efficient. When medication further relaxes blood vessels, the body may not adjust fast enough, leading to dizziness or loss of balance. This is where the risk increases. Even brief dizziness can result in a fall, and falls are one of the leading causes of serious injury, hospitalization, and loss of independence in people over 65. Because of this, alpha blockers are rarely used as first-line blood pressure treatments in older adults unless there is a specific medical reason. When they are prescribed, doctors typically use the lowest possible dose and monitor symptoms closely. These medications can be particularly risky during certain times, such as standing up quickly in the morning, getting out of bed at night, or rising after sitting for long periods. Doctors often advise patients to stand slowly, pause before walking, and report any dizziness right away. Importantly, never stop these medications without medical advice. The concern is not that they are unsafe for everyone, but that they require careful supervision in older adults. Number 5 includes diuretics, commonly called water pills, such as hydrochlorothiazide. These medications are widely prescribed for high blood pressure, particularly in older adults. Diuretics work by helping the kidneys remove excess sodium and water, reducing fluid volume in the bloodstream, and lowering blood pressure. Because they are effective and affordable, they are often recommended as first-line treatment. However, aging affects kidney function, thirst awareness, and fluid balance. Research shows that older adults are more prone to dehydration, even when taking diuretics exactly as prescribed. Dehydration can cause fatigue, dizziness, weakness, dry mouth, and confusion, symptoms that may develop gradually and are not always linked to medication right away. Diuretics can also affect electrolyte levels, particularly sodium and potassium. Low potassium can lead to muscle weakness, cramps, and abnormal heart rhythms. Low sodium levels are associated with confusion, balance problems, and increased fall risk. Studies also show that diuretics are linked to orthostatic hypotension, as reduced blood volume makes it harder for the body to adjust blood pressure when standing. This significantly increases fall risk in older adults. Another consideration is timing. Because diuretics increase urination, they can cause frequent nighttime bathroom trips, which further raises fall risk. For these reasons, regular monitoring is essential. This includes blood tests, seated and standing blood pressure checks, and ongoing medication reviews. Diuretics are effective, but in older adults they require personalized dosing and close follow-up. Number 4 includes calcium channel blockers, such as amlodipine and diltiazem. These medications lower blood pressure by preventing calcium from entering heart and blood vessel muscle cells, allowing vessels to relax. They are widely used in older adults and are generally effective. However, as the cardiovascular system ages, blood vessels stiffen and blood pressure reflexes slow down. Research shows that calcium channel blockers can contribute to orthostatic hypotension by limiting how quickly blood vessels tighten when standing. This can cause dizziness and unsteadiness, increasing fall risk. Some calcium channel blockers can also slow heart rate, cause fatigue, and reduce exercise tolerance. Another common side effect is leg and ankle swelling, particularly with amlodipine. While often considered minor, swelling can affect walking and balance over time. These effects often develop gradually, leading many people to assume they are simply part of aging. Medical guidelines stress the importance of using the lowest effective dose and reassessing treatment regularly. When combined with other blood pressure medications, the risk of low blood pressure increases. Calcium channel blockers remain valuable treatments, but they require careful monitoring and individualized care. Number 3 includes beta blockers such as metoprolol, atenolol, and propranolol. These medications slow the heart rate and reduce blood pressure by blocking adrenaline's effects. They are especially beneficial for people with heart disease or rhythm problems. However, in older adults, beta blockers can sometimes slow the heart too much, leading to fatigue, weakness, and dizziness. As heart rate response becomes less flexible with age, beta blockers may limit the body's ability to increase blood flow during activity. This can contribute to balance problems, especially when combined with other medications. Some beta blockers are also associated with sleep disturbances and reduced mental sharpness, particularly in older adults who are more sensitive to these effects. Research shows that beta blockers may be less effective at preventing stroke in older adults when used solely for blood pressure control. For this reason, they are no longer first-line treatment unless there is another clear indication. They remain important medications, but dose adjustment and regular review are essential. Symptoms such as fatigue, dizziness, or balance changes should always be discussed with a healthcare professional. Number 2 includes ACE inhibitors such as lisinopril, enalapril, and ramipril. These medications relax blood vessels by blocking the production of angiotensin II. They are commonly used to treat high blood pressure, heart failure, and kidney disease. However, older adults may be more sensitive to their effects. ACE inhibitors can cause excessive drops in blood pressure, particularly when starting treatment or increasing doses. This may lead to dizziness and falls. They can also affect kidney function and increase potassium levels, especially in older adults or those with existing kidney disease. This is why regular blood tests are important. The well-known dry cough associated with ACE inhibitors can disrupt sleep and increase fatigue. A rare but serious side effect is angioedema, which requires immediate medical attention. ACE inhibitors are effective and beneficial for many people, but careful dosing, monitoring, and communication are essential in older adults. Number 1 includes angiotensin receptor blockers or ARBs, such as losartan and valsartan. These medications work similarly to ACE inhibitors, but are often better tolerated. They relax blood vessels and lower blood pressure without causing a persistent cough. However, they are not risk-free. ARBs can still cause low blood pressure when standing, increasing the risk of dizziness and falls. They may also affect kidney function and raise potassium levels. Many ARBs are prescribed in combination pills, which can increase the risk of dehydration and electrolyte imbalance if not monitored closely. Because these medications are so common, side effects may be mistaken for aging. Regular blood pressure checks, including standing measurements, are essential. Blood pressure medications save lives. But in older adults, the right medication, dose, and monitoring are more important than ever. As the body changes with age, medication effects can change too. Understanding these risks helps you stay informed and actively involved in your care. If you found this video helpful, please like, subscribe, and turn on notifications for more evidence-based health content for older adults. Let us know in the comments which medication surprised you the most and why. And remember, never start, stop, or change any medication without speaking to your doctor or pharmacist first. Thank you for watching, and I'll see you in the next video. Dr. Sarah Williams.